Welcome to Edison TV. On Wednesday, the 8th of December at 3 p.m, we will be kicking off our digital health series, exploring the investment opportunities in digital health. In our first webinar, we will be speaking with 3 listed companies providing digital health services into the UK and other markets, discussing how we build a healthy ecosystem which benefits all. In the lead up to the webinar, I will be catching up with the C-suite executives on the panel from Babylon Health, Dr. Care Anywhere, and Kooth. Today, I'm speaking with Dr. Ali Parsa, founder and CEO of Babylon Health. Hi, Ali. Thank you very much for speaking to us.
Thank you for having me, Max.
Fantastic. So to start with, please could you just give a brief overview of Babylon Health, including your technology and business model?
Max, as you know, there are 2 fundamental drivers of costs in healthcare. Babylon was created in order to make healthcare accessible, affordable, and put it in the hands of everybody on earth. There is no such thing as accessibility without affordability. So our focus is, how can you make healthcare so affordable that everybody can access it? And there are 2 facts about healthcare that are a truism almost everywhere in the world. On one hand, almost 70% of all our costs are on predictable, preventable problems. And on the other hand, almost 2/3 of all our costs are on salaries. Doctors, nurses, healthcare professionals are among the rarest and therefore the most expensive assets of many countries. What we try to do in Babylon is to say, how do you solve these 2? And that goes to the core of both our technology and our business model. So on one hand, we try to collect so much data for our members to be able to understand them, to be able to therefore predict that what direction they're going to go, to be able to prevent. And on the other hand, we try to, when crisis, emergencies, actions happen, we try to automate as much as possible so that our people, the human resource in that, is as little as possible to be able to make our model of care highly scalable. Now, one of the problems why healthcare doesn't happen in a preventive way is because all the budgets in healthcare are always spent on the crisis and emergencies. Imagine a dental things. A huge amount of money in dentistry goes into crisis. You have a root canal. Nobody needs a root canal. Nobody should ever have a root canal if your teeth are monitored regularly. But because we don't, we'll end up with the pain and the expense. That is almost true about 70% of the costs in healthcare. So all we do is to try and avoid those emergencies and crises. But in order to do that, what you mentioned about value-based care, all that means is that we try to get the entire budget of the patient so that we are able to then reinvest the money upfront, as most health systems don't do, in order to be able to keep people as healthy as possible to avoid those emergencies and crises.
What has been driving your continued revenue and contract growth in 2021? Particularly in the US, where there is stronger competition among telehealth providers?
So you're absolutely right. There are too many, a lot of telehealth providers. But I don't understand what problem telehealth solves. Because if the definition of telehealth is you can see a doctor behind a mobile phone, it's true, it solves the problem of accessibility. But that doctor is as expensive behind a mobile phone as they are in an office, and not as reactive behind the mobile phone as they are in an office. The reason our model works, and last year we grew almost 4-fold, and the year before that we grew almost 4-fold, is because our pitch to our payers, our insurance companies, our customers is a very different one. Our pitch is that just give us the medical losses that you know you have budgeted, and instead of you just sitting back and paying for people's crises and emergencies, we manage these people proactively. We look after them in order to keep them healthy so that those crises and emergencies don't happen. If things go wrong, our problem, our money, our loss. But if they do go right, The difference will be our profit. So from a customer's point of view, at the very least, what they get is a security of the fact that their losses or their medical expenses are predictable and secure and understandable and with certainty. But at the plus side, they know that somebody is now incentivized to value their members, look after them really well, to serve them rather than just sit back and pay for their crisis. I think that is why we're seeing such huge growth in our business. We actually have more customer demand than we need right now. There is a reason why we've been growing for the year every year. Is because we cap it at that level where we can grow probably a lot faster and more than that. But that's the right level of growth for us. And I can see massive demand coming our way still for years to come.
Fantastic. And you listed earlier in the year on the New York Stock Exchange. Can you just give us the reason for the listing and what are the intended uses for the net proceeds?
So we listed because any company at some stage should list to give access to our earlier investors to liquidity and all of those things, and also to give access to us as a company to what is the world's largest capital market. So it's a natural part of doing anything. We chose a SPAC because it was a faster, easier way of doing it. Now in the process of us going through SPACs, the SPACs fell out of favor with people, so it had teething issues. For us, it doesn't really make a difference. I mean, once you're public, you're public. The resource that the capital we raise for that is to finance our growth. I mean, as I said, how many companies, Max, do you know that are growing at fourfold a year? I mean, not just in healthcare. And what is really interesting to me is the vast majority of digital healthcare companies are growing at double-digit percentile points. We're growing at triple-digit percentile point. And one that is very rare in healthcare. If you go back and look at the earliest stages of any other industry that was digitalized, from e-commerce to finance to any other, you will always see there is a very small group of companies that at the earliest stages of their development were also separated from the pack and were growing at triple-digit growth. And what that signifies for us is the market fit, is that you have something that the market needs, as opposed to what you were describing before, which is being one of many, many competitors arguing over a commodity business. And if you see that, and we see that, then you need to fuel that growth with the resources you need in order to take advantage of it.
Great. And what needs to happen to ensure that the benefits from the growth of digital healthcare are enjoyed across the patient spectrum, both in the private and public sector, as well as across demographics?
Look, healthcare is a $10 trillion industry. If you put all digital healthcare companies together, and the revenue wouldn't even touch 1% of the global healthcare sector, there is a massive way to go. We will this year make north of $300 million of revenue. We've been, even if we grow 100-fold, will still be less than 1% of US digital healthcare company. I think what needs to happen is for those of us who are enjoying the growth we are to continue doing what we are doing. I think that what we will see is that $10 trillion industry melting almost bit by bit into it, in the same way that the old-fashioned finance industry did, in the same way that old-fashioned commerce industry did. Everybody talks about e-commerce. We must remember that was 20 years in the making for us to be comfortable to acquire everything digitally now. I think that if you and I talk in 20 years time from now, or 10 years time from now, we will be talking about a small number of digital healthcare companies that have become among the most valuable companies in the world. And the job of your listeners, your investors, is to choose and see who those companies are, and hopefully enjoy extraordinary returns for their investments by backing those companies. But they have no doubt in your mind that this is at the very beginning of one of the world's largest sectors transforming, and that transformation will create some of the world's largest, most valuable companies.
Well, thank you very much, Ali. It's been a very interesting conversation.
Thank you for having me, Max.